So this is our amazing Dr. Shoreh Omidi. She's been with us for a few years now, and Dr. Omidi has done quite a few videos on hormones. So today we want to talk about, I want to ask you a few questions about women's hormones, potentially men's hormones, postmenopause. So if that's okay with you, we'll start?
Sure.
Okay, so what age would you say you see people with hormone issues?
Oh, they depend on the person, because some young people, they have a low like testosterone, or they have a low estrogen, progesterone. So but mostly people, after they go to menopause or postmenopause or premenopause, then they see a big shift in hormone. And so usually women gain weight, especially around the stomach and the hip area. And even if they are skinny, still you can gain some weight around the hip area, and it doesn't go away. Even you work out or have a good diet, still you have this problem. And that is not because you're fat. It's just because your hormones are out of balance. So usually the first hormone for women after menopause that goes is the estrogen. Mm-hmm. So there is a lack of estrogen, and then after that there is a testosterone that goes, because woman has testosterone too. And that's why when you're younger, this gives you energy, and it gives you, you burn fat more easily. And usually when the woman goes through menopause, the testosterone is diminished, and that's why you feel sluggish and tired all the time, and you gain weight, and you have lack of energy. So that is due to the testosterone. And then progesterone is gonna go away, and that's women suffer with the hot flashes and all, losing hair and all of the good things.
So you touched on a lot of things. So have you seen your patients with acupuncture and herbs, and you can talk about which one you feel is more effective? With Chinese medicine, how does Chinese medicine have a positive impact on, we're speaking specifically about women right now, with testosterone, estrogen, progesterone? How do you see women's health improve, specifically in that, women having hormone issues?
So the patients that I have seen are usually they have less hot flashes, they have more energy, they sleep better, they have less foggy memory when they get acupuncture. And especially if they combine the acupuncture with the herbal medicine, the effect is double. So they get them, best result if you do it that way.
Yeah. I tend to treat acupuncture with herbs. Do you have patients who only do herbs for hormones?
I have maybe a couple of patients that they only do herbs. Yeah, but majority of people, they have a combination of herbs.
Yeah, I prefer the acupuncture with the herbs.
Yeah, and most people prefer acupuncture actually, because some people, especially younger generation, they don't like the herbs, they don't like the taste, even though now it comes in a capsule, and so you don't taste it, but still, some people, they don't like to take herbs.
Yeah. The way I like to treat is acupuncture, and then I will do 3, 5, 10 treatments, see how they're improving. And then if they're seeing results, I may just keep them on the acupuncture. But if I want to see faster results, let's say they're not at least 50 to 80% in 5 or so treatments, then I'll add herbs. So what's your methodology do you start them with herbs right away? Do you wait a few treatments? How do you like to treat people with herbal medicine? Specifically these patients who are doing acupuncture.
I prefer to get some get to know the patient and their body, how respond to acupuncture treatment, and then after that I put them on herbs. But I don't start with the herbal medicine.
Oh, so you and I are similar in that case.
Yeah.
So, for example, for myself, 48 and over women, those typically seem to be the women who are inquiring about perimenopause, menopause, issues. What age do you tend to see women with hormone issues, specifically like the menopausal, the hot flashes, the night sweats, irritability, not sleeping well?
Yeah, usually people between 48 to like 56, 58, you see it in those people more often.
Yeah. I had a patient today, and she's 48, and we've been together for many, many years, since she was pregnant, and now her kids are teenagers. So she came in, she said, "I'm so angry today." And she left laughing. So that gives me happiness. That's part of what I do. So what is something that you really, and it doesn't have to be hormone related, and this could be hormone related. What makes you happy as a doctor of Chinese medicine? Like when you say, "Oh, I love," because for our medicine, people can get treated and then leave happy.
Yeah.
That's part of people love acupuncture. So what is, like, whether it's hormone related or anything else, what is the gratification you get from Chinese medicine?
So the best gratification is when I have a patient that they go to so many different doctors that they still don't know what's wrong with them, or they don't get their symptoms doesn't improve as much as they want. And when I see those patients, and then after a couple of acupuncture treatment, then suddenly they feel better. They feel like more active, more energy. They feel like like I have patients with really bad back pain and postural issue, and then suddenly they walk more straight. They have they can walk for a longer distance. They can be active with their grandkids, and so when I see that makes me happy, because I feel like I gave something back to somebody that can enjoy their life better.
Good.
Fully. They live their life fully.
I love it. Before we close up, are there any teenagers that you treat? Because that's another hormone thing. Yeah. Do you like to treat teenagers?
I do. I have some. I don't have too many teenagers, but I have some young adults, like 21, 20, that they have an issue with acne and a skin problem, and that is just hormones, basically. And so, but I do have microneedling treatment also I do in my office, so some people benefit from that.
So what is it that, can you describe that?
The microneedling. So microneedling is a device that, basically it's very precise. There are many, the headpiece has many small needles that automatically, very fast, and you can put it in different
settings.
Yes, setting. And so puncture the skin. You don't feel it really, but it's puncture the skin, and when the skin is punctured, so the blood rushing to the area to heal it. So what it does, then it brings all the chemicals, all the nutrition, all the blood, and that's why the healing begins.
I have another. It's gonna ask for one more. So, you can schedule with Dr. Omidi at elementsinharmonyacupuncture.com, and you'll see her beautiful picture and her link, and you can see her resume there and a bunch of other videos that she's done. Is there anything you want to say in Farsi to the Persian community or anyone who speaks Farsi?
I have some Persian client. Not really. Yeah. You know,
Do you want to say anything?
acupuncture is a great. Say
You want to
it
say
in
it in Farsi? Yeah. Because we have patients who.
Yeah.
Yeah.
اگه دوست دارین که به طریق نچرال خودتون رو خوب کنین و از دواهای وسترن مدیسن زیاد استفاده نکنین چون همشون ساید افکت دارن، بنابراین اکیپانچر is the best بهترین روشیه که بتونین نچرالی خودتون رو خوب بکنین.
Okay. Anything else you want to share?
No, thank you.
You did an amazing job. Thank you, Dr. Omidi.
Thank you.